Sorry for interruption of the video of streaming and due to internet problem. We can continue if you want to continue. Okay, this is my last case. We have synovial osteochondromatosis involving the left hip. So the patient has multiple osteochondromas involving both iliac bones, one here, and multiple osteochondromas involving the left side. Okay, we move to the next case. Okay, what do you think about the next case the patient has? What do you think the patient has? Sorry for interruption. There's some internet problems. We restore the connection and hoping it will not interrupt it again. So what do you think the patient has? Okay, what do you think the patient has? We need answers. We need answers for this case. Okay, we need answers for this case. What do you think about this case? Okay, we have some answers and from the next case, and someone write sign. This is the apparent sign of the fibrous dysplasia. This is a case of the fibrous dysplasia with Ren sign. Okay, we move to the next case. What do you think about the next case the patient has? What do you think the patient has? Some answers and from the what do you think the patient has? We need answers for the next case. We need answer for the next case. Very good, Dr. Malham. Very good, Dr. Malham. Okay. Okay, we received some answers. Not all are right. And we see here osteoborosis circumscripta in Paget disease. This is osteoborosis circumscripta in Paget disease. So this is a case of Paget disease manifested by osteoborosis circumscripta. Okay, very good. Okay, we move to the next case. What do you think about the next case the patient has? What do you think the patient? Good, Dr. Shatha, Dr. Nis. Okay, what do you think the patient has? Next case. Very good, Dr. Roa. Very good, Dr. Roa. This is a case of osteoid osteoma. Okay, this is a case of osteoid osteoma involving the femoral neck. So this is a case of osteoid osteoma. Very good. We move to the next case. Okay, what do you think about the next case the patient has? Here, this is the link again if you want to receive your certificate of attendance, and you can fill the required fields, your name and your email, and you will receive the certificate. Okay, so this is, as we said, it is a case of the previous case. It is a case of osteoid osteoma What do you think about the next case? Sacralization of the, very good, Dr. Malham, very good. Sacralization, very good, Dr. Tarawna. Okay, okay, very good, very good. Okay, we answer the case here. This is a case of the sacralization of L5, as we see here, with pseudoarthrosis, with fusion on here on the left side and pseudoarthrosis on the right side. So this is a case of sacralization of L5. If you don't want to write sacralization, you can answer a transitional lumbosacral articulation. Okay, we move to the next case. What do you think about the next case the patient has? What do you think the patient has? Very good, Dr. Kamal. Very good, Dr. Kamal. Very good, Dr. Kamal. Very good, Dr. Abu Abid. Firas Abu Abid. Very good. So this is a case of burst fracture. Burst fracture of L1. This is a burst fracture of L1. We should use the correct terminology and description of the fracture. This is a burst fracture. We should use the word burst fracture of L1. Okay, we move to the next case. What do you think about the next case the patient has? What do you think the next case the patient has? You want to continue the webinar? If you want to continue, I am ready. If you don't want, we can postpone the next cases to another webinar. Okay. If you want to continue, I am ready. If you don't want, we can postpone it to another session. Okay, we received some answers. Dr. Al-Rudi, we received this is okay. So we have some answer of this case, and this is a case of osteosarcoma. Okay, as we see here, this is soft tissue mass with osteoid matrix in the paraosteal region, and this is a case of osteosarcoma. Okay, so this is a case of osteosarcoma. We move to the next case. What do you think about the next case the patient has? What do you think the patient has? Next case. Okay. Okay, very good, Dr. Malham. Again. Very good, Dr. Malham. Okay. So we can answer the question. This is a case of Guinea worm disease or Dwancolliasis or Guinea worm disease infestation, and it is manifested by calcification in the soft tissue. So this is a case of Guinea worm disease or Dwancolliasis. Okay, very good. Okay, we move to the next case. What do you think about the next case the patient has? Again, if you want to receive certificate of attendance, you can fill the required field and your name and email, and you will receive the certificate. Very good, Dr. Malham. Okay, very good, Dr. Shantus, Santhush. Sorry for I cannot pronounce your name. Okay. Uh, okay. If you want to receive the certificate, you can fill the required form. Okay. So we have this case. This is a case of incondroma involving the fifth metacarpal bone. So this is a case of incondroma. Very good, all of you, for answering this case, and we move to the next case. What do you think about the next case a patient has? What do you think the patient has the next case? Okay, we received some answers. Okay, very good, all of you. Okay, we have complete supraspinatus tendon tear. We have complete supraspinatus tendon tear. We have complete supraspinatus tendon tear. Okay, we move to the next case. What do you think about the next case patient has? What do you think the patient has? Very good, Dr. Malham. Okay, very good. Okay, we will answer the case. This is a case of vertebra plana, as we see here. This is a case of vertebra plana. You should know, you should memorize the causes of vertebra plana in children and adults. What is the commonest cause in children? What is the commonest cause in adults? This is one of the MSM multiple choice question. And what are the differential diagnoses and multiple of vertebra plana in children and adults? What do you think about the next case the patient has? What do you think the patient has? Sacroiliitis, very good. Dr. Nies, ostitis condensus iliae, ostitis condensus, not dissecans. Ostitis condensus iliae, very good, Dr. Shadi. Okay, so we have this case, ostitis condensus iliae. Ostitis condensus iliae, you see the sclerosis involving the iliac part of the SI joint bilaterally, and this is seen in female. There is no erosions. There is no erosion. It is not ankylosing spondylitis. There is no erosion and only sclerosis of the iliac bone of the iliac side of the sacroiliac joint and no erosion. It is ostitis condensus iliae. We move to the next case. What do you think about the next case the patient has? What do you think the next case the patient has? What do you think the patient has? This is welcome our colleagues from other countries. welcome other my colleagues from other countries other than Jordan. Okay, what do you think? Okay, okay, we received some answers. Okay, the patient has chondrosarcoma here, peripheral chondrosarcoma, but the patient has multiple osteochondromas involving both sides of pelvis and involving the upper femora, and one of the osteochondroma, it is termed to malignancy. This is chondrosarcoma, and probably another chondrosarcoma involving the another osteochondroma here. So this is a case of chondrosarcoma complicated multiple exostosis. Okay, we move to the next case. What do you think about the next case the patient has? Very good, Dr. Santush, for ring and arcs classification in chondrosarcoma. Okay, we receive some answers. We need more answers. Osteochondritis dissecans. Okay, bipartite patella. We have this patient osteochondral defect or osteochondritis dissecans involving the medial femoral condyle. This is osteochondral defect or osteochondritis dissecans. So this is an osteochondral defect or osteochondritis dissecans involving the medial femoral condyle. Okay, we move to the next case. What do you think about the next case? What do you think about the next case? Don't dislocation, very good, Dr. Nis. Very good, Dr. Asad. Very good, Dr. Ivan. No, it is not VZ. Dr. Shadi, it is not VZ, okay? So this is we move to the answer, and this is a classic case of leonid dislocation. This is a classic case of leonid dislocation. Okay, we move to the next case. What do you think? It is very simple. this next case. Okay, this is very simple. Next case. What do you think about the next case? Here it is again, your link for attendance of the certificate. If you want to receive the certificate attendance, and this is very good, Dr. Shantush, and this is hemangioma, vertebral hemangioma, very good. We receive some answers, polka dot sign and corduroy sign, both, it is both. So we receive some answers. This is a vertebral hemangioma involving this vertebra and this vertebra. This is the sagittal, this is the sagittal, and this is the axial, and this is this is the corduroy sign, and this is the polka dot sign. Okay, very good, both for you answering this question. We move to the next case. What do you think about the next case the patient has? Okay. Okay, we move to the next case. What do you think the patient has? Very good, Dr. Santhosh. Okay. Very good, Dr. Malham. Very good, Dr. Asad. Okay, we move to the answer. This is loosening of the knee prosthesis. This is knee prosthesis. After 4 years, we have loosening, and we have loosening here or particle complication. So this is loosening of the knee prosthesis. Okay, very good, all of you, for answering the question. Okay, this is particle disease and loosening of the, and we move to the next case. What do you think about the next case the patient has? We someone write we need description about each case. Here we have for review for spot cases. We only mentioned the spot case diagnosis, and in another talks we have the discussion of these cases, but this is because the examination is on the way. About after 1 week we have spot cases, and this is only we answer the spot case. Okay, Dr. Nis, very good. This is very good, Dr. Nis. Okay, so this is very good, Dr. Mustafa, Ivan Mustafa, and Dr. Malham. Okay, we have this case. This is a case of acromegaly, as we as you answer, and we have a spade sign, a spade sign or spade shape uh, distal phalanx, and this is a case of acromegaly. So we move to the next case. What do you think about the next case the patient has? What do you think the patient has next case? Very good, Dr. Ether. Very good, Dr. Ayman. Very good, Dr. Al-Audi. So we have some answers and we move to the answer. This is a case of olecranon bursitis. This is a case of olecranon bursitis due to gout, and as we see here, there is erosion of the olecranon nervosus. This is erosion of olecranon nervosus, and this is olecranon bursitis due to gout. So we move to the next case. What do you think about the next case the patient has? What do you think the next case the patient has? Look at the case and see what do you think. This is a case, not budget disease. If it is budget disease, it should have bone marrow bone scan uptake, but there is no uptake in the bone scan. So this is not budget disease. Okay. Very good, Dr. Nies. Very good, Dr. Ivan. Okay. Very good, Dr. Ithar Al-Badri. Okay. This is a case of, as you see here, multiple bony islands and multiple striates, and the bone scan is negative, no uptake in the bone scan. So this is a case of osteopathia striata and osteoboriosis. So this is a case of osteopathia striata. Here the striata, and these are small dots of the osteoborosis and negative bone scan. So this is a case of should not confuse with other differential diagnosis. We move to the next case. What do you think about the next case? This is simple. Okay, what do you think about the next case the patient has? Okay, we received some answers. Very good. We have a neurismal bone cyst involving the scapula. This is a neurismal bone cyst, a neurismal bone cyst involving the scapula, and we have multiple fluid levels. We have multiple fluid levels in the cyst. Okay, so this is a neurismal bone cyst involving the scapula with multiple fluid levels. Okay, we move to the next case. What do you think about the next case the patient has? What do you think? Someone write about answer code fish, sickle cell disease, come out very good. Okay, we need more specific for this. Okay, we receive some answers, and the answer of this question, this is a case of sickle cell disease. As they said, we have removal of the gallbladder, and we have infectious spondylitis or discitis, spondylodiscitis involving this vertebra with loss of the joint space. And we have each vertebra or codfish vertebra of sickle cell anemia. So this is a case of infectious spondylitis involving the spine, and the most common organism is, as you know, it is salmonella. Okay, we move to the next case. What do you think about the next case the patient has? Okay, what do you think the patient has next case? What do you think the patient has? We receive one answer, Dr. Malham. We need a more specific answer. Okay. Giant cell, no, it is not giant cell. Osteosis. We need more specific for osteosis. We need more specific. We need more specific. Okay, we answer this question. We have an osteosis here. Okay, and it is called subangual osteosis. Okay, we have osteosis here, and this is called subangual osteosis, arising from the distal phalanx of the thumb. Okay, this is subangual osteosis. So we move to the next case. What do you think about the next case the patient has? Okay, we receive some answers. Very good. And we have this case, a vascular necrosis of the scaphoid. We have all the fracture of the scaphoid, and we have a vascular necrosis of the scaphoid involving here. Okay, we have a vascular necrosis of the scaphoid. Okay, we move to the next case. What do you think about the next case the patient has? What do you think the patient has in his frontal sinus? What do you think the patient has his frontal sinus? Very good, Dr. Santush. Very good, Dr. Shadi, Muad, and Kosa. Okay, this is a case of right frontal sinus ivory osteoma. This is right frontal sinus ivory osteoma, and we move to the next case. What do you think about the next case the patient has? What do you think the patient has? The next case. Okay, we received some answers, and this is Lisifranc injury. This is Lisifranc injury. Okay, we received some answers, and this it is less frank injury or fracture dislocation, and you should know the types of less frank injury, how many types, and how to differentiate between the types. So we move to the next case. What do you think about next case? We present this case in our previous discussion. What do you think of the next case? And we call this Abel curve sign, and we call it, this is Abel curve sign. And what do you think of the cause of this case of Abel curve sign in this case? So we present this case in our previous discussion, and we call this, it is Abel curve sign. It is involving the right femoral neck. And what do you think about the cause in this patient? What do you think? This is the cause. What is the cause of Abel curve sign in this patient? Very good, Dr. Kosa. It is a case of synovial chondromatosis. It is a case of synovial chondromatosis. This is a case of synovial chondromatosis. Very good, Dr. Kosa. We move to the next case. What do you think about the next case the patient has? What do you think the patient has in the next case? Okay, it is very easy, and it is a spot diagnosis, very spot diagnosis. What do you think? Very good, Dr. Shadi. Pellegrini-Steider lesion. This is a case of Pellegrini-Steider lesion. This is a case of Pellegrini-Steider lesion. This is a calcification involving the medial collateral ligament. This is a calcification involving the medial collateral ligament. Okay, we move to the next case. What do you think about the next case the patient has? What do you think the patient has this case? What do you think the patient has next case? This is again the link for receiving the certificate of attendance. If you want to receive that, you fill the required fields, your name and your email, and you will receive the certificate for attendance of this webinar, musculoskeletal imaging spot cases. What do you think about the next case? Okay, we receive some answers. And this is a case of glomus tumor, and this is a case of glomus tumor. As we see here, soft tissue swelling with pressure erosion on the distal phalanx, and this soft tissue mass, and it is enhancing vividly after contrast. This is a painful glomus tumor. Very good, all of you, for answering. And we move to the next case. What do you think about the next case the patient has? Very good, Dr. Ivan. And this is a case of this is a case of acromioclavicular joint dislocation or injury, and according to the Rockwood classification, it is between grade 3 and grade 4, and this need treatment. This is need surgical treatment most likely. Okay, and this is a case of the acromioclavicular joint injury dislocation, and here this is the grades of the injury and dislocation. We move to the next case. Okay, what it is very simple. What do you think about the next case the patient has? What do you think the patient has? Okay. Okay. What do you think the patient has? We receive some answers. Okay, this is a case of mallet finger, mallet avulsion fracture. This is a case of mallet fracture. This is a case of mallet fracture. Okay. Okay, this is the last case, and you see this is avulsion fracture from the distal phalanx and associated with soft tissue swelling. And this is the last case. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. And this is again the link if you want to receive your certificate, and you can fill your name and your email, and you will receive the certificate. Next spot diagnosis cases. Next spot diagnosis cases. It is pediatric spot diagnosis. This is spot next spot diagnosis cases. This is pediatric spot diagnosis, and these webinars, as you know, it is saved on my web page. It's saved in my Facebook page, and you can return to it anytime you want. And if you missed your certificate, also you can fill the certificate link in the as it is seen in the Facebook, my Facebook page, and you can fill it anytime you want. Okay, thank you for all of you from our colleagues from all countries. Thank you very much, and hoping to see you inshallah next webinar for pediatric sport cases. And good night all of you. تصبحون على خير والسلام عليكم ورحمة الله وبركاته. البث مو بحفظ على الماي فيسبوك بيج، على الماي فيسبوك بيج والمحاضرات السابقة والكيس ديسكشن السابق. We have this is the number 12. We have 12 webinars. It is on my Facebook page. Also some, it is in, not all of them, it is in my YouTube channel. Okay, thank you very much, and see you soon inshallah with pediatric imaging spot cases.